Welcome to another episode of Clinic Success Secrets, the podcast where we uncover the strategies and insights that drive clinic growth and elevate patient care. I'm your host, Tommaso Dwyer, founder of Clinic Success Partners, a medical digital marketing and automation agency dedicated to helping clinics serve more patients and achieve the success that they deserve. Today, it is my absolute honor to welcome Rechelle Trejo, founder of Auri Aesthetics. Rechelle has an extensive background in aesthetics, having graduated from ASU School of Nursing in 2003 and received advanced training from top international aesthetic experts. She's also a national trainer for Galderma, one of the top aesthetic pharmaceutical companies in the US. Rechelle has grown Auri Aesthetics from a single room to a new location with multiple rooms and providers, emphasizing team growth and exceptional patient outcomes. We'll explore her journey, the business strategies behind her success, and valuable insights clinic owners can apply to scale their own practices. Rechelle, it's an absolute pleasure to have you here today.
Tomas, thank you so much for having me. I appreciate the opportunity.
So before we get stuck into what you're doing today and where you guys currently are, would you mind sharing a bit more in detail about your own journey? What decisions and actions brought you to where you are today?
That's a good question. I fell into aesthetics. I think some people go out searching for it and looking for it. I didn't know anything about aesthetics. I just knew I didn't like hospital nursing. I didn't like hospital medicine. I appreciate those who do that. There's such a love and energy that goes to that kind of medicine. But for me, that's a very draining offering. And I knew that I would be drained from doing that. I needed something that filled me. And so for me, outside of even medicine, I love to create. I love to be able to create things of beauty, things of value. And so when I learned about aesthetics, I realized this is a platform in medicine that I'm able to create. And it just blended so synergistically with what I like to do in my own life. And so I kind of fell into it. I found out about it and was like, oh my gosh, yes, this is the kind of medicine I want to practice. This is what I want to do. And it, slow process of learning and growing. And originally, yes, single little room, and my brother is a physician in his office. And then grew to the point where other people wanted to train with me. Other people wanted to learn from me. I've been doing this, 13 years. So I've had definitely some experience in this at this point. And these other people who learned from me, they wanted to stay with me. They wanted to also be employees of my brother. And it just got to the point where this one little room was not housing all of us well. It just wasn't going to work. And so I could have just left and done my own, single salon suite, done my own thing and had the other girls go on their own. But I cared too much about them and about the opportunity to allow others a place to grow and succeed and meet their ambitions and their goals. And so I created Auri as a business to allow that for others, to provide an environment where growth and success in your dreams are a possibility. And it's grown from, the small little couple rooms that we had to now we just moved into our brand new space, the beginning of 2025 this year. So we now have 5 rooms and full build out and all of the fun that goes with that. And now we have, I've got 4 injectors, 2 estheticians, and growing. So
and a partridge in a pear tree.
Yeah, exactly. And you know what, we talk about the providers, but let's be honest, it's the behind the scenes people who are maybe even more critical to the success of those providers. You cannot do this without the behind the scenes people. So props to all of them as well. They have their jobs harder than the rest of ours.
I love that. I'd like to dive into that, but first, I love what you're saying. I'm not going to even say this pun is unintended because it came to me and it is intended, but there is a beauty in aesthetics.
Oh yeah.
Terrible pun aside, but I have a call with another previous podcast guest of ours, Dr. Mark Yoon, and he says he coined a term which I love, which he described aesthetics as happy medicine.
Oh,
You know,
100%. Yes. It
which I
is a
think is such
happy
a
medicine.
it's such a lovely frame. It's you're going and you're genuinely lifting up the you're taking what's already great, but you're really giving that new lease of life, helping them forge into that new identity, the people that they want to be. And I think there's so many books outside of frame, but psycho-cybernetics, and it talks about this whole idea of, as you want to progress in life, it's really about taking on that new identity. And I think the work that you do is beautiful insofar as you're aiding that. You're giving that little
Mhm.
catalyst to help people, and take on new leases of life in different areas. So I really, really love
Most
that.
medicine is sick care, right? If you think about
Yeah.
it, most medicine is sick care. You're taking care of sick. Even though we claim it's health care, it's
Yeah.
really sick care. And so to be able to go from sick care to health care is beautiful, and then go to health care to then wellness care or beauty care, or it's even a more elevated approach to your basic medicine. And so it's happy medicine for sure. I agree with
Yeah.
that.
Yeah. It's the difference between taking from a negative to a neutral, but you're taking a neutral
Mhm.
to
To
a
a
positive. So
positive,
yeah, which I can imagine must be incredibly fulfilling. Correct me if I'm wrong. And you can
100%.
speak to this. I can only imagine the Auri Aesthetics dynamic. You know, share a bit what it's like actually working in Auri Aesthetics. What kind of culture do you guys tend to foster? Because I have a good feeling it's a nice one. I'd like to hear more about it.
Like I said, growth mindset, for sure, that we all are working towards growth, not just as a business, but individually. So we care
Mm,
deeply about our team members and what their ambitions are, what their goals are, whether that means, um, that they're in a place in their life where they've got young kids, and that's the priority, is those young kids, and making sure that they are there, they're available, they're home for them. Or maybe it's now they're looking at retirement and making sure that we have options for 401ks. And so essentially looking at them as not just the employee who's here doing their tasks, but as a person. They are right,
yeah,
and they have their ambitions and their goals, and it's how do we help them achieve those, whatever they may be. Maybe it's they want to be a trainer. Okay, let's get you to the point where you can start teaching others, that you can start reaching those goals. Maybe they want to bring on other services that we don't quite offer. Okay, do your research, come back, pitch us on what that is, and let's see if that's something that makes sense for this practice. um, I think one of the most frustrating things would be to be in a workplace where you don't, there's no growth, that there's no
yeah,
potential for what it is that you're passionate about, and you can't see your way forward. And that would be a very limiting place to be. So, very much growth minded. Um,
yeah.
and naturally, as the individuals are growing and succeeding, the business is going to succeed. It takes care of itself.
Mhm.
So, that just goes hand in hand.
Yeah. There's a lovely metaphor that I referred to in an episode we did just before Christmas. A gentleman called Jimmy Yen. And he says something lovely. We started going very esoteric on the podcast and the meaning of life and all that good stuff. But he said something that really jumped out. And he'd been running a clinic for 20 or 30 years. And he used to be, he said he was doing the, 100 hour weeks and all that kind of stuff. And he
Yes,
said,
originally, yeah.
yeah, and you
When
need
you're
to
first
brute
starting,
force.
that's a reality.
Unfortunately, yeah, because you don't have leverage. And fortunately, you need quality and you need quantity, but the only way you get quality is by getting the quantity and you get the reps in, and you haven't got the help. But what he says something that honestly, I can genuinely say reframe the way I view business. And I've got my own team, and I'd like to think that I have a great relationship with them all. We're doing team retreats and all that kind of fun stuff. But he said something which was nice, which was he views the purpose of the founder or CEO or owner of the business. It's like it's not even to increase the bottom line anymore. He's like it's to grow my team's individuals, spiritually, financially, and professionally. And he's like the second he started focusing on that, and he had actual goals for every team member. And in all those different areas, he said the second I started focusing on that, the bottom line just skyrocketed because, as you said, no one wants to be coming to work dreading it. They need to be excited, invigorated, and as you said, feel heard and feel like they have the opportunity to grow. So I love that there's alignment there, and I love that that's a big priority for you.
Yeah. So then a practice that we follow for that, because we do the same thing, is we do one-on-one monthly meetings with every single team member. And in
Mm.
those monthly meetings, they come to us. So they actually schedule it. They come to my practice manager with their goals, their ambitions, where they know all of their numbers. We're very open. So they get to see what their numbers are, what their KPIs are. They're tracking everything themselves as well. So that way they can come and they can say, okay, this is where I'm succeeding. This is where I want to do better. Where is my knowledge gap? So that way I can get there. And so we work one-on-one with every single person, and personal goals, like I said, having that be a part of it. Because you become motivated when your goals are heard, your ambitions are heard, and then you're able to see how to get there. You have the tools that you need to be able to access that. So I think saying that is great, but that we have to have a practice to actually be able to implement that as well.
I think there's an interesting, again, I'm saying this on the fly, but I think there's an interesting parallel there with the whole idea of aesthetics in general, which is if you're reinforcing and managing people through fundamentally fear, here are your KPIs, you need to hit them. People do the bare minimum, but they'll never push for it, to excel. Whereas if you're saying, right, the stick is more potent than the carrot in the short term, but over a longer time horizon, the carrot is what gets you going and avoids burnout. And I think people go above and beyond when they're genuinely excited. And so there's a parallel there with this whole happy medicine idea. We're really trying to step and grow beyond the current our current capability. So I love that. You mentioned the back house, the people behind the scenes, and how important that is. Could you share a bit about what those roles are and just why those team members are so important to you at Auri Aesthetics?
Yeah, absolutely. So, I mean, starting just with receptionists, I think that's probably the hardest job, because they get to be the first experience, the last experience, and everything in between. So that first experience with the phone call, making sure that the phone call doesn't end at how much is your Botox, right? How do you navigate that conversation in a positive way where the patient's coming in for a consult? Because each of those calls, if you're doing Google ads and if you're doing anything like that, search engine optimization, costs you money. So every single patient who doesn't come in costs you money, and just increases the cost of running the business. So everything from optimizing lead generation from websites to patient interactions, making sure that the patient feels heard, that you're scheduling appropriately. My goodness, that list goes on and on for that receptionist. Like all of the tasks that they get to deal with is immense. So having somebody who is knowledgeable, who's friendly, who and knowledgeable in the services that you're offering, that can speak to them, even though they aren't performing them, they need to be able to speak to them. And when a patient calls in, be able to hear them, understand what it is that they're asking, and then offer them a solution to their problem without even knowing how to do it. I mean, that's a big ask for somebody. We're actually hiring for another receptionist. We have one, but I like to have two in the office. And so I'm doing interviews all day today after this, and that's what my day is. And that is a hard position to fill because they have to be exceptional. Practice manager is another one that we have. That again is critical, especially as an owner. I don't want to do all the roles. I don't want to manage the practice. I don't want to manage the business. I don't want to manage employees and inject. You can't do all of those things. And so having somebody who can take off the things that you don't want to do. Like I don't want to be worrying about inventory and ordering supplies. That's not something I want to be worrying about. I can do more in other areas. So having a practice manager that can work with the whole team, again, I think a critical component to a practice, making sure that everything's in place, providers have what they need to, everybody is trained. If there is a knowledge gap, that they are facilitating learning opportunities, so that way that knowledge gap can be filled. So practice manager is huge. Then you can go even into beyond people who are necessarily medical assistants, things like that are helping the office run smoothly. But then you have to look at, okay, your marketing. So social media manager, who are you using for your SEO, for your website design, for updating, all those types of things, who are you using for your marketing? Are you doing Google ads or Facebook or Instagram ads? And so it's a lot. And then you have your accounting, you have your bookkeeper, you have, all of the different roles, because it's not just, and maybe if it was a small, I can't even say that. I was going to say, even as a small single provider,
You need
you will
to.
be working 100 hours, because if you're seeing patients and then you are still required to do all of those other things, you will be working 100 hours a week. And at some point, you have to look at it as, is this really financially beneficial? Yeah, you may make money while you're injecting, but then if you divide it across those 100 hours, your profitability just dropped. Like
Yeah.
it plummeted. You may think in your head, oh, I only worked, 24 hours. I made good money. But in reality, no, that's not the
Yeah.
truth. And it's being honest with yourself. So there's a lot more that goes into running a business than what you see when you walk in the door.
I agree. And I'll definitely touch on that in a second. But I mean, again, I'm very touching on the role of the receptionist, because I'm actually going to go on in on this in a minute, because I've a few meetings this week where we need to discuss this. Again, my background is biomedical engineering. So although I believe everything boils down to the quality of your relationships, very data driven. And when we're growing any business, again, this is great for anyone listening. There are four levers we can pull to grow any business. And that's the traffic, the conversion, and the price, and the churn, the lifetime value. And again, what we do, Clinic Success Partners, is you want to get the traffic. You want to get, and traffic for anyone listening really just means how many people see your business or your website or your product, whatever it is you're selling. And when you look at it through that lens, you have your search engine optimization, you have your ads and all that kind of stuff. It's great. Max that out. Perfect. But where a lot of people miss out is they're not getting that conversion part. And we've had clients where I think it was literally we were getting insane results on Google Ads, and I had to have a conversation with them. I was like, we're tracking your calls. 50% of your calls aren't being answered by your receptionist.
Aren't even being
Like,
answered.
no, as in they're
Oh,
falling through. Yeah. So
oh,
I was like,
yeah,
I'm
that's a
calling
problem.
all. Yeah, it's a significant problem. I was like, you've
That's a
just
problem.
halved your return immediately, if
Yeah.
not worse, because there's
And how many of those that you actually talk to do convert to actual consultations for patients? Yeah.
exactly, and it's
I
a
think the percentage is 25% is industry standard, around there, 25%. Our goal is
yeah,
80%. We want 80%
wow,
of every single call to actually be converted to at least a consultation. So
wow, and
that's our
I'd
goal.
love
We're
to.
at about 60% right now. We were right at 20. We were right there at the industry standard, and we've bumped it up to about 60%. So we're constantly working that narrative,
Nice.
training, to bring that up.
Nice. And I'd love to hear more about that. But again, I just want for anyone listening, make sure just check on your receptionists. I'm sure they're great, but as you said, the fastest when I'm doing my business consultations, what we often say is one of the fastest ways you can double your return on marketing, etc., is double the conversion rate of people that either arrive on your website and make an inquiry,
Lead.
or
Yeah.
lead and turn to a patient, or someone picks up the phone and converts. So again, I cannot stress that enough, because so many
100%
people,
agree.
they're like, oh, I'm doing my marketing and they're doing this and that. I'm like, yeah, but how many of those are actually booking appointments? So it's so essential. On the topic of you pushing for that excellence with regards to the 80%, what sort of systems have you've been implementing to boost that? Are there a script that people are following, SOPs? How does that look?
Yeah, so one is just educating on services so that way they can speak intelligently to our offerings. Two is scripts. So we have generic basic scripts, things that credential both the practice and the providers. So credentialing taglines, meaning somebody calls in and it's, why are we going to choose Auri over another med spa? Auri has performed over 10,000 different aesthetic services. We are, whatever it is that you're trying to articulate and push, but be able to have that grounded in an achievement. So that way you can speak to that. We also, which is, and I know this is painful to do, we recorded, and it says, when you call and it says, this is a recorded, call may be recorded for training purposes. We actually recorded our calls and we had our receptionist go back and listen to them. Again, not us. We want them to listen to themselves and critique it. How could I have done better? What could I have implemented? What could I have said out of all these little taglines or these things that I have? How could I have changed the dynamic of this conversation? To be able to do it and then practice. We actually did fake phone calls, like acting, which, like I said, so painful to do, but so effective because it helps you to be able to articulate it. It helps you to be able to, when somebody calls in and, well, how much is your Botox? Oh, thank you so much for calling us. What is your name? People love to hear their own name. So Tomas, thank you for calling. I appreciate you taking the time to choose Auri Aesthetics, right? Just something as simple as that. And helping them to see that it's not the price. Everybody's selling Botox. We're all selling the same stuff. We're all doing the same thing. What makes you different is your offering, how it is that you're going to do that, your results, the patient experience. And helping somebody who you don't know on a phone see the value in that can be very, very difficult. So that's where I think that receptionist training is so, so critical. But yeah, those are some of the systems that we put in place and training we put in place to elevate that.
I love that. It's amazing. And I love this sort of role play idea because again, it's not something
it's painful, but it's good.
It's cringy. I'd say that they're mortified, but again, the nice thing is they're subconsciously setting the benchmark that this is how I'm going to behave in future. So they'll know, if, for example, Rechelle's to walk through the reception and she hears a receptionist acting entirely different to how they did in the role play, there's a discrepancy there. So it's really operating with that doors open policy that I'm a big advocate of.
Yeah, the authenticity throughout everything.
Exactly. Radical honesty and transparency. That's the theme of how we do business. On the topic then of, there's so many skills that you've mentioned. Before I even say this, and this is the topic of growing businesses, when you're a single provider, as you said, you're probably working 100 hours. If you're growing a bigger practice, probably not working 100 hours. The point being is, regardless, growth mindset of how big your goals are, you're going to be working either way. So you might as well aim for, what's that saying? Aim for the moon. Even if you miss, you'll land amongst the stars. You're going to work anyway. So dream big. If you think you can or you can't, you're probably right. On the topic though of the skill sets, there's a book I quote all the time, and I'm sure it's been said to you plenty, the E-Myth Revisited. Medical professionals, and I'm saying this with love, generally out of any kind of college or what have you, great technicians, amazing at the providing side of things, but the managerial and the business,
awful business people, awful. And I will say that you don't even need to say it with love. Just say it. It is what it is.
I'm saying it with objective truth.
But you're right. It's 100% true. We are. There's no training in medicine. Even doctors, dentists don't get training on how to run a practice, and most of them go into private practice. Nurses, that's not even a thought. NP, I'm in my NP program, my master's program right now, just about to finish it. And there was no conversation about that. There is about billing insurances, but this is cash pay. So there's nothing that's, it's completely different. And so there is understanding that you have to either have that knowledge yourself, acquire it yourself, or find somebody who does. Work with somebody who does have that strategic knowledge, because you can't do it all. So yes, you need that.
So on that then, obviously, 13 years ago, you didn't have the skills that you have today. What did that roadmap look like for you to develop those strategic skill sets that you have picked up? Did you get a mentor? Were there books, courses?
All of the things, yes.
All of the above.
All the above. I had mentors for sure, but honestly, I am very, very fortunate that my husband is a business background. So that's what he does, is he essentially operates, well, he doesn't operate. He's the controller for, like 40 different companies. So he knows how to manage businesses, and he has taught me a lot. And he's taught me, what is a balance sheet? What does this mean? What are, KPIs that we should be watching, that we should be looking for to see, is this successful? Is this actually going to be beneficial? So I've had to learn a lot along the way, and still learning all the time. I think getting into a learning practice, if you don't have somebody literally in my back pocket, right, my husband, that I can lean on, then you need to find those people. You need to find the accountant, the bookkeeper, whatever it is, who can do it for you. But then also yourself, you need to be in some type of a learning practice that encourages that knowledge acquisition. So for us, the way that looks is we do weekly meetings. We actually hired a business consultant, and we're doing weekly now. It's bi-weekly meetings where we're looking at individual points of the business and how can we make each and every single one of those run more effectively, run more smoothly. And it's not a cheap endeavor to do this, but the knowledge that we have gained from that, worth every single penny.
Yeah,
every single penny.
The best investments are generally within yourself. Again, as my mother used to say, education is never a heavy burden. So
and you have to be in a continuing learning practice. Otherwise, you're not going to be able to grow. So you don't know what you don't know. You may see it because you start having problems. You start having things that come up, whether it's patients aren't happy, employees aren't happy, you aren't getting the lead conversions, with your calls, whatever your systems are, you see breaks in there. And so it's going through every single touch point and finding out, is this excellent or is there room for improvement? And then dissecting it and then creating, either acquiring that strategic knowledge from someone else or creating your own system to be able to address the issue.
I think, as you said, there's the whole Dunning-Kruger effect. You don't, the less you know, the more you think you know. You don't know, you don't know, whatever way you want to dress that up. And if you don't talk to a professional who really knows his stuff, like your husband does on the accounting side of things, you don't know what benchmarks you should be shooting for. Like as you said, the 25% conversion rate for sales. It's great to know that, because you could be at 12 thinking, I'm
doing great.
Why not? Sounds
and your patients are costing you $250, every single time that you get them. And so you really didn't make any money on any of the patients. You lost money.
You're wondering why you have cash flow issues. Well, because you could. Exactly. So I think that's great. On the again, obviously you gained a wealth of experience having your husband with the accounting experience. You've got business consultants, all that kind of thing. For anyone listening, again, maybe a good technician, but the business side of things, they're still brushing up. What are the main financial metrics that you think clinic owners should be keeping an eye on closely in order to ensure long-term profitability?
I think, knowing your costs and your profit is just the first basic one. And that was what we looked at before we even decided to open up our previous places. We looked at, okay, what is Rechelle able to generate in a year? What are the costs? So what is our profit? So just profit cost, right? That's basic. And I can't tell you. So I train and I will go into practices and we'll be talking about products. And I'm like, well, what's your markup on this? Like, how much are you generating from this? And they're like, I have no idea what my costs are. And I'm like, how do you not know what the product costs you? How are you able to even then make a decision on
charge?
No, yes. So I think that's going to be your most basic one. And then it's looking at all of your other costs, overhead, things like that are going to be other things. But key performance indicators is going to be your rebookings. How many of your patients are rebooking? What's your average ticket? What is, when a patient walks in, what's the average just over the course of all of your patients? What are you generating? That's going to help you project for the future. If you get another patient, chances are you're going to be able to increase that amount. Memberships. I think memberships are huge, and being able to have that membership ensures a greater foundation for your practice. Gross month over month, year over year analyzation. Where are you at? Where's your numbers? That's going to be another big one as well.
I love that. I think
I'm sure
that's
there's more.
very.
Those are the ones I'm thinking of because we do a daily KPI report for our entire team. And so
Wow.
we know our year over year analysis, and we're always reaching above our previous year, month over month, right? So it's like, okay, what did we make for January last year? Okay, our goal is 10, actually 20% higher is our goal every single month. But we have, and you talked about motivating your employees. So we do bonuses based on that. So we do monthly
Mm,
bonuses based on which tier we hit. I feel it is a great way to motivate your employees to know that you're in it together, that it's not
mm,
just, oh, the business is making more money. You are as well. If we are
mm.
growing, I want each of my employees to benefit from that as well. So we do monthly bonuses based on our year over year revenue growth.
Nice. I love that.
But you
Again,
have to know
Karen.
that,
Yeah. If you, what gets measured
right?
gets managed. Yeah,
Yeah, you
exactly.
have to know that.
Yeah. No, I love that. And again, because we will definitely be talking about the marketing side of things, what's worked, what hasn't worked, insights. But rewinding a bit, Rechelle Trejo herself, you talk about the growth mindset. You alluded to this earlier on that you have a creative tendency that you like to make things, share a bit about, if you don't mind, where that kind of stems from. Do you always have this growth mindset? Were you creative? Were you painting, growing up, where did that
The
inspiration come from?
creativity, I know. I think there's a book I read, and I can't even remember the name, but it alluded to the fact that there's something in each of us that makes our heart sing, that brings us joy, like a true foundational core of who we are. And what is that? Like, what is it that drives you? And I was a stay-at-home mom for 8, 9 years. Um, and that was, I mean, loved it, loved my children, but it was hard
Mm,
for me to love being at home, and my life revolved around little kids, right? Like it was feeding
mm,
them and taking care of them, and that's what it was. So during that time, I had to find something, some way to be myself and to be able to have something for me. And I didn't realize it until years later, but always I was working on something. There was always some
mm,
project, there was something I was learning. And like I said, I didn't even see it when I was in it. It wasn't until I stepped back and I started looking at my life, over the course of years that I realized, oh, this room, I completely retextured all the walls. I repainted everything. I redecorated everything. I was always creating something. Or if I was
mm.
in the kitchen, it wasn't just making dinner, I was making croissants from scratch, right? Like
Yeah.
always creating. I loved to garden. So it wasn't just going out and, pruning something. It was, okay, I'm going to completely tear up the landscaping. I'm going to redo the watering line, and I'm going to redo the entire land. I was landscaping. I would be gardening and landscaping and doing everything. Um, it's that creation is what fuels me. And some
Mm,
people, it may be designing. It's not actually doing the creating, it's the designing. It may be, whatever it is, but I think coming and finding, which takes work to come to know yourself. That's
mm,
hard work. But it's very truthful work if you're willing to do it, because then you get to the core of who you are and what it is that drives you. Aesthetics is another way for me to be able to create. The patient comes in, they have their concerns, they have their questions. And really being able to listen to them, to hear them, to not just hear the lines and the concerns that way, but what is it at the core? Why are they wanting to do this? Then being able to design an offering for them that meets not just let's fix the wrinkle, but I don't want my grandkids to think I look angry at them all the time. They always say that I just look so
yeah.
angry and I'm tired, and grandma, why is this? Okay, let's get to the core of that. So there's an emotional response to that.
Mm,
You feel happy, you want them to be able to perceive that. Okay, so it's not just let's do the Botox. Let's help you so that way you have that confidence that you do look refreshed, you do look vibrant, you do look healthy. So it's more than just the treatment, it's the outcome, being able to get to the
mm,
outcome that they're wanting. Again, we all are offering the exact same things. So if you don't have a way to differentiate your outcomes, what's your offering?
yeah.
Why are they going to come to you?
So it's like
Um,
you're, oh,
no,
sorry.
go ahead.
I was gonna say it sounds like you're taking like an inside out approach as well as the outside in. It's a two-pronged yin and yang type
100%. So
thing.
wellness, I think, is huge coming into aesthetics. I think it's a very much a growing part of aesthetics. And so Wellness meaning biostimulators, more regenerative type medicine, I think is becoming really, really popular. But even wellness in terms of hormone replacement therapy, peptides, all of
Mm.
that is huge growing. So the more that we can get to helping them feel better and look better, I think both coincide together very synergistically. And being able to design to meet what it is that their goals are. So if they have a wedding coming up in a month, then regenerative probably isn't going to do a whole lot for that
Yeah.
wedding in a month. We need something that's going to be fast acting. We're getting it on board now. But I want you to stay looking good. This isn't just a short-term plan. So we're going to keep you stay looking good with more of that regenerative type practices. So it's not just let's fix the problem, it's let's come up with a solution here.
I love it. You're not just addressing the symptoms, you're addressing the root simultaneously. So it's the long
Mm-hmm.
term, short term balance. And again, I could nerd out about regenerative medicine. I've done it enough times.
Yeah.
To be honest, it's an area that I love. For me, med spas, regenerative medicine, ultimately, I don't know. For me, it's fascinating.
Yeah.
But I just want one thing I wanted to say, and I want to kind of throw this to you on the idea of creation and all that kind of thing was outside of clinic success secrets. I for a while I was running a podcast focused more so like men's mental health and things like that, and I had the honor of talking to a gentleman called Bob Coffin. God bless him. He passed away basically after, but lovely man. He I don't know, lots to learn from him. And I was asking him basically, old man, you know, uh, separate conversation. I'll get emotional, but I basically said, cliche question. What's the meaning of life? Like I know it gets thrown out there so often, but I wanted to hear his opinion. And he said something to me, just the way he delivered it. He just looked at me. He said, Tomas, I was like, yeah. He said, would you say God is a creator? I said, I suppose so by definition. Yeah, it's the way
Mm-hmm.
it's defined. I was like, well, you were made in God's image. So go create something. And
Mm-hmm.
I just thought that was such a beautiful way of doing, build something and enjoy the process of doing so. Because that's what's we don't win life. We play life to
Mm-hmm.
win it. We're in life to
Mm-hmm.
to 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 just live it. So I don't know, create something meaningful. And I want to just throw that out there because
I love
I
that. And
don't
I totally
yeah,
believe that. I think that's one of the divine gifts from God is our own ability to create. We get a little bit of him and our own
yeah,
ability to be able to create in this life. And I think what a beautiful gift.
yeah. We're a God experiencing life through consciousness or whatever. But um, putting back, it's a segue here, and I actually don't even
Oh,
feel
it's
bad
all
even
good.
talking about the
I can
business
go
side of things.
all
Or
over.
I know we probably would, to be honest. We had 2 or 3 hours. Um, I'll put on the business and marketing cap on again for a second. But um, when you were starting off, obviously you were fortunate that you had access to the physician's clinic. As you grew the team to where it is today, what sort of marketing strategies did you implement as time went on, and where did you get the most amount of success?
So initially, this is starting off, in my brother's practice, it was 100% word of mouth. That's all
Mm.
it was. Word of mouth. Some of his patients that would be interested in aesthetics, he would push over our way, and then you treat one, and then they tell their friends, and it just grows from there. Um, we would do discount like Botox groups where if one person came in and they brought all their friends, then they all got a discount type thing. I did find though that once I wasn't willing to cut my prices that low, most of them left, meaning
Mm.
those Groupon patients are always going to be Groupon patients. And not
Yeah.
all of them. I would say half of them stayed and have continued to be patients now for 13 years. But there are always going to be those that are just looking for the cheapest. They're just looking for the lowest priced. And when I wasn't willing to do that, they're going to go find it elsewhere. So that's why I have never been a fan of, you know, huge discounts, Groupons, things like that, where your pricing, you're just racing to the bottom is what you're doing in those situations. It's a race to the bottom. So we we did do those types of things in the beginning. We would have promotions, we would have discounts, buy a syringe, get a syringe half off, whatever it was at the time, just to kind of build that. Um, Oh, what other things did we do initially? That was probably all we did initially. And then when we moved and it became Auri, we started website search engine optimization. We've always had a referral program in place where if they refer, then they get a benefit as well as the person that's coming. Um, those are probably our grassroots efforts. And then from there, now where we are is more lead generation from our website. So automatic replies that are integrated into our electronic medical record immediately. So we see all those leads and then we're able to respond to them. So it automatically gets sent to them from the website, a notice or information or a little blurb, but then we get them as well. So we're able to follow up. It also shows exactly where on the website they were at when they clicked. So were they in fillers? Were they in trainings? Were, whatever it was that they were looking at. So then we're able to speak to that. And our receptionist takes care of all of those. So following through with all those leads, um, Google ads, Instagram, Facebook ads. We do target marketing. So when we have events coming up, we actually will look at zip codes around us and we'll say, okay, what are the zip codes? What are the ages that are typically patients, are coming in and getting these types of treatments? And we'll do targeted ads towards them. So that way it's not just throw everything out and hope something sticks. It's a little bit more focused.
Yeah.
I'm probably missing some things, but those are the ones that I can think of right now that I know we're actively doing.
Nice. I love
we
that.
have a
And again,
billboard. We just decided to try a billboard.
okay,
So
nice.
we've got a
And
billboard up for the next 8 weeks. We'll see how that goes.
out of curiosity, then on the because I can't not ask the billboard. How are you tracking that? Do you have like a separate number that gets forwarded, or are you just saying?
So billboards is just exposure because
Yeah.
there's no way to track it. There's no way
Yeah.
unless somebody comes in and says, I saw you on a billboard and I came in. But what are the
Yeah.
chances of that? Very, very, very low. We always
Yeah.
ask every patient when they come in, how did you hear about us? And we make a note in the chart so that way we have reference to that. But I mean, billboards are more recurrency. How often did you see it is how much it
Yeah.
sticks. There's a lawyer in our town where I swear there's a billboard every 100 feet of him. And the only reason I know his name is because I make fun of it.
Yeah, it's imprinted.
Right? Because I'm like, it's freaking imprinted in my brain now. And I don't even know what type of lawyer he is. I have no idea. But I just know his
if you
name
need
because
one.
yeah, exactly. But I know it's every 100 feet. So it's now imprinted in my brain. So billboards, I think, are more of a loose marketing concept, if I'm going to be honest with you. It's not your targeted, it's more just exposure. Yeah, it's general exposure, I think, is what we were going for. We have a new location, so we wanted to target general populations on a new med spa in a new location.
Nice.
Is
You
what
can
our goal
always
was.
detour on your way to work as well for a little
Yeah. Do you know what's funny is I pass by it every single day and I don't even look.
That is so funny.
I should, but I don't even look. I don't pay attention.
It's going to be so trippy for someone that if you're ever stuck in traffic and they'll just be
looking at me.
it's the girl from the billboard. That's funny. Nice. And then I suppose in terms of again, I'm conscious of time here, although I know we could literally talk for probably 2 or 3 hours. In terms of learnings that you've had when running across these different platforms, you've mentioned Facebook, Meta, Facebook and Instagram, SEO, website, all that fun stuff. What were sort of some of the biggest learnings that you've had along the way across these different channels? If any jump out.
So I think Instagram, because it is an aesthetic, more picture focused platform, I think Instagram is a great one. I know it is not my favorite thing to do. I will be very, very honest with you, but I know it is successful. I've had patients who have followed me for years and come in and they're like, I've followed you for years and I'm finally making the jump. I'm ready. Or, even people when they're searching, they're like, oh, I just moved to the area and I found you on Instagram, which to me is bizarre that we're finding our medical providers through Instagram, but it works. Facebook, I think, is another effective one. I will admit I am not as savvy in Facebook, so we just do it through Instagram and have an auto post to Facebook. I'm not as savvy with Facebook, but if you look at who is your target audience, who are your patients who are usually coming in, what age bracket are they in, where are they at, is more important and more relevant than where you want to be, right? Is where are your patients at? So we know that our patients are both on Facebook and Instagram. So we are on both platforms. And I think people have a definite preference as to one or the other. Like I have lots of patients who are like, oh, I'm not on Instagram, but I am on Facebook. So I think it's important to do both. I'm on LinkedIn, business type platforms. I don't do Twitter. I probably should, but I don't. You should probably do all of them. It's just your bandwidth. Like, yeah, it's your bandwidth. What do you actually have the ability to do? But I think there's benefit to being just a presence. It's kind of like the billboard, right?
Yeah.
Is there any direct tie that you can make? But it's just your presence that you are known in the world of aesthetics.
Yeah. I always say this with our clients, fundamentally the internet is a marketplace. So it's getting more and more busy. And as a result, the buyers are becoming more and more savvy. So you really do need to be showing up everywhere. And it's such a cliche point, and again, I love the fact that, again, as old school as it is, just asking where did you hear from us? Because what we find often is, someone could arrive on the website from SEO, and then you get retargeted on Facebook, then on Instagram, and then you might see the billboard. And it's an accumulative effect, where it's not as easy to find out. It's not a case where, 5-10 years ago, you see an ad on Facebook, you probably make the investment right there because you've never seen it. Now people are doing their due diligence. So I think you need to have an entire holistic ecosystem, really.
Yeah. And they're all speaking the same narrative. Make sure that what it is that you want people to know is uniform throughout, meaning your values, your messaging, that it's not scattered, and they don't see the connect between this messaging and this messaging because there's no correlation. There's no marketing, whether it's your logo, your color scheme, whatever. That way, when they then go to the website, they're like, oh, this feels familiar. There's synergy between all of those.
Yeah. No, I love that. Honestly, we've been covering a lot within an hour, and
we kind of went all over the place.
Yeah, but I loved it. I mean, I'm having a great time. So I don't know about you, but last question, one more esoteric one, because I think the conversation was veering that way whenever we got the chance. What is the impact that you want to make in business, and for your team and life in general? Simple question.
Oh, for my team is for them to fulfill their goals, their ambitions, their dreams. I mean, it's different too from a provider standpoint, right? Like I look at things very differently because I work both areas.
You wear a lot of hats.
Yeah, I wear both hats. And so as an owner of the practice, it's 100% on my team. It's making sure that they are able to achieve what it is that they want to achieve. And their ambitions may be huge. And I will be their biggest cheerleader along the way, making sure that they are able to reach that. From a provider standpoint, then it's going to be patient-centered. And what is it that my patients' goals are, and how can I help them? But regardless, it's outwardly facing in the sense that that's where the joy is creating either an environment for my employees to succeed or an environment for my patients to be able to achieve the results that they're wanting. But either way, I'm creating a space for growth, success, and optimal outcomes.
I love that. Help more people, as I always say.
Yeah. So, you rise to the top a lot faster when you're all rising together versus trying to push everybody down.
Exactly. Yeah. So. When other people are rising, pull them up with you, and then they'll do the same.
You all are able to rise together.
Yeah, and you enjoy it. That's the big thing.
It's a lot more fun than trying to be negative and push everybody down. That is a draining energy.
Yeah, what I always say is that life is a dialogue. I journaled this years ago, but I always quote it: "Life is a dialogue, not a monologue." So give back. It's not all about you.
Yeah.
Rechelle, this has honestly been, I can genuinely say, probably one of by far the most enjoyable episodes and interviews that I've had since starting the podcast. I've really enjoyed this.
Well, good.
Where can people find more about you and what you do?
Auri Aesthetics, so AURI aesthetics.com is going to be our website. We're located in Gilbert, Arizona. And then on our Instagram is going to be my name, which is very long. It makes me think, man, I should have had a shorter name. Rechelle Trejo Aesthetics. Yep. Or Auri Aesthetics would be able to find the business. So that's where you can find us.
I'll include all the links in the show notes. So
Perfect.
thanks so much. Until we do
Thank
this again,
you.
hopefully. Cheers.
All right. Yeah.